Then we move over to something that I really, really like, which is stimulus control and motivation building. Okay, stimulus control, again, is how, it's like it says here, you know, who, what, when, where, why, what. We try to account for all these things, all these triggers, all these inputs into the problem. Before, with habit reversal, we were just dealing with the physical behavior itself. Now we're going to deal with all the things surrounding that behavior and that affect it and that are inputs to it and that can influence it in some way and cause the behavior to happen. So, okay, so let's talk about what is stimulus control. It's actually a very old behavioral treatment, very well known. It says a behavioral treatment that seeks to help sufferers first identify and then eliminate, avoid, or change the particular activities, environmental factors, states, or circumstances that trigger undesirable behaviors. So it's basically anything that feeds into the behavior or triggers it, we want to be able to identify and then modify in some way or eliminate it. It says the goal is to consciously control these triggers that lead to pulling and the other behaviors, of course, and to create new learned connections between the urges and new non-destructive behaviors. So we're trying to forge new connections. So in other words, where you were sitting on your sofa, leaning over, pulling your hair before, now maybe we're going to sit in a different spot. We're going to sit in a different posture. Maybe we're going to have something for our hands to do. We're going to come at this thing from a number of different directions. So now, what are the parts of stimulus control? There's a number of components here. One is we look for stimulation replacements. So there's other ways to get stimulation that are not self-destructive. Stimulation reducers. In other words, for when you're overstimulated, ways that you can calm yourself. Relaxation is one of them, but there's a whole bunch of other things that you can do to reduce your levels of stimulation. Again, we're trying to maintain this balancing act here. We're trying to stay within this zone, but at the same time, we want to do things that will not lead to the habit itself again. Habit blockers, things that just, like our habit reversal with our fist clenching, that's just one type of way you could block yourself from doing the habit. There's many others. Changes in your environment and routines, very important. Reminders and attention getters, again, I'm a big believer in that. All my patients use lots of Post-it notes. I'm real big on Post-it notes because you take them down when people come to visit you and you can put them back when they leave. And belief enhancements, in other words, things that enhance your belief that you can accomplish this, that you can do it, that help your motivation, basically. There's a habit blocker. Here's clown collar right there. So, anyway. So first thing we're going to talk about are stimulation replacements. Okay, now these are some things, and actually I brought with me, I hope it oh no, here it is. But I left it blank. I just brought this to show you. Sometimes I remember this and sometimes I don't. Some of these things you may know about already. I just briefly wanted to show you. I always take this out and show this to my patients. In other words, you want to find ways to get stimulation without actually doing the behavior itself. And these are like substitutes. For instance, some of these you may know of already, like Koosh balls are very popular. There's like little spiky ones and feathery ones. Some people like these. Not any one of these things works for everybody. There's some are very popular, like these stress balls, these sort of clay-filled like things. You've probably seen these before. Or they have these sort of cloth-like sack things that fill with little beads inside. Some people like those. They're very tactile. Then there's other things that are a little more unusual. Or then there's foam balls also for some people. But again, they don't work for everyone. Brushes. Brushes come in many types. This is just one type. This is a mushroom brush, believe it or not. I got it in an IKEA store, but all different kinds of brushes out there, which I'll get back into those. But some people like things with bristles on them. Surgeons' scrub brushes are very popular among some of my patients. Particularly most people seem to like the stiffer one than the softer one. These are what surgeons use to scrub their hands before surgery. They come in a number of different types, but these are pretty cool, and people really like this. It's very kind of, they like this, they get a lot of tactile stimulation from that. Little hand toys, like little miniature slinkies are popular among some people. And there's something I was going to share with you today, which is my own invention. I can really take credit for this because I don't think anybody else thought of this. This is the best loved thing among all my patients. I have to tell you that my patients like this better than anything, and I'll show you what it is. Very simple and it's very cheap to make. I got this at Home Depot. These are a kind of lock washer. They're sort of star-shaped. They call them tooth lock washers. And I have people string them together, and when you some people like sort of like pointy, stimulating things to their skin. So when you put them together like this and you squeeze them, these little points like dig into your skin. But they don't cut you or anything, because, you know, they can't hurt you at all, but they're very stimulating. It's the most stimulating thing for a hand that I've ever found, believe it. All it takes is a piece of string and a couple of dollars worth of these little washers. Kids like them, adults like them. Sometimes I'll give them to a person to try and I'll have to like wrench them back because they don't want to give them up. Yeah?
Have you ever found that somebody might end up abusing one of these things, like rubbing the brush on their skin so much it'll start to...
Never had that happen, no, to be honest with you. People would be more likely to just go back to their original habit before they would do that, because that's really most satisfying. I don't pretend that these things are going to beat out these things completely, but they may be enough of a competition for it that a person will still prefer to do it and can learn to make do with it under the right circumstances. But my lock washers are definitely, these are the single most popular thing, and I always mean to bring them to these meetings, and I finally remembered to bring it this time to show you. It's not a big deal or anything, but it really works, that's all I can tell you. People really like it, yeah?
We promise to return it or send
Okay, you got to return it. It's the only one I got right now. They're so hard to make that I might not remember how. Here, you can pass that around. I like cheap, low-tech solutions to things.
Excuse me, can I ask you a quick question?
Yeah.
This is really kind of
Okay. I'm sorry. Can everybody else sort of keep that a little bit so we can hear the question?
This is kind of rewinding a little bit back to where you had the cartoon with the dog with the collar.
Yeah.
And basing on with the repetitive needing for the stress. Has there ever been a study done where rather than replacing the motion and the focus of whatever with a absolute abstinence of it? Like, I'm not suggesting a dog collar.
Well, I tell you why. Theoretically, that might not be a good idea, and it's a very sort of. I'm a very common sense kind of guy, very nuts and bolts. But I believe that if you're going to take something like this away that somebody uses to regulate themselves, you better give them something to replace it with, because it's going to be so compelling. They're going to go back to whatever it was, and you're going to fail.
Over a period of time, it would be interesting to see if there would be a study done.
I think it might be, and you know what? I think almost everybody's probably tried abstinence at one time or another, and I don't think it's worked for anybody for the most part. Maybe it worked for a few people. These are very complex behaviors, and that's why I'm showing you all these different things. You have to hit this thing from a whole bunch of different directions if you're going to be successful. That's why single approach methods to doing this don't tend to work, because there's so many inputs that you got to cover all your bases if you're going to be successful with this. If you just try to do the, like the thing to squeeze in your hand, that's the only thing you're doing, you're probably going to fail, because there are many more inputs that are going to get around that and defeat you. So let's talk about stimulation replacements. You can brush your hair, massage your scalp. These are all things that have worked for various people I've worked with over the years. I've worked with hundreds of people by now. Brush or massage your pet, as long as you don't pull out their hair. Some people, it's called trichotillomania by proxy, as a matter of fact. And there are people who pull hairs from other people or from pets, or threads out of clothes or furniture and stuff like that. It's a very tactile thing. In fact, my son who's autistic, he likes to cut labels out of garments and pull them apart into individual threads. That's his little stim thing that he does. Actually, he used to have a terrible nail biting problem, but I'll tell you later how we got rid of it when I get onto the more biological end of things. Engaging in hobbies that involve the hands, like musical instruments. These are all pulling threads from fabric. I guess I don't have to read all these, but you can sort of see what's involved in them. Yeah?
Just another one to add to the list, perhaps. I love pulling weeds.
Oh, yeah, I've heard that one. I should add that, actually. I'll try to remember to put that. I have some more here, actually. These are like troll dolls are very popular, or these other things that I showed you before. Hot scrubbers, some people use Velcro, the hook half of the Velcro. Bubble wrap, stuffed animals, my lock washers, my pink lock washers. I put those on here because I still think those are about one of the best things. Miniature slinkies, rubber bands, paper clips. Dental floss or fishing line. I have a woman who likes to split her hairs. She pulls them lengthwise. She looks for split ends. So she's been working with dental floss lately and finds that quite helpful. She can split the dental floss, and that kind of, it's not a perfect substitute, but it seems to work pretty well for her. She seems to, find it's a good thing. There's more even here. There's, that's what they say on the infomercials. They say, but wait, there's more. But wait, there's more. Yarn or thread. This is very good for people who like to bite hair bulbs and things, sesame seeds, or people like to chew on hairs and get them to try to use sunflower or pumpkin seeds. I usually advise people to stay away if you're going to use candies or gum or mints, make sure they're sugarless. Actually, I have people who created severe dental problems with things like, I've had like Tic Tac addicts. I've had 2 Tic Tac addicts who literally destroyed their teeth and needed like thousands of dollars in expensive dental work. No kidding. There are Tic Tac addicts out there. Maybe one day would be a Tic Tacs Anonymous. Drawing, or this works sometimes like people when they talk on the phone, especially. It seems to work with people. They can often, this is helpful. I have a couple of patients who do this. Or video games that require both hands, although some kids I found are very clever and can operate a video game with one hand and pull with the other, so you have to be careful with that. Now, along with stimulation replacements, if we can find a good replacement for it, something that's pretty close. Again, I tell people, I say, I don't kid myself and think we're going to find the perfect replacement for this, but maybe, just maybe, we can find something that's really close. But beyond stimulus replacements, there's also stimulation reducers when you're overstimulated. As I mentioned before, yoga is very good. Meditation or stretching. It sometimes helps to reduce levels of physical stimulation within your body. Exercise is very good. Releases all kinds of endorphins in the brain, and we know there's a long history of exercise helping depression. It's been documented clinically that it does it. In fact, one of my supervisees did a study on the effects of exercise on obsessive compulsive disorder and found that it also had a positive effect on OCD. So maybe we should do a study for these kind of behaviors. Maybe I wish we had the resources. Maybe I will get a student to do that one of these days. Taking a warm bath. Cold packs can be very good too, especially for the people who do eyebrows and eyelashes. I find cold packs sometimes kind of numb the area or just reduce stimulation in those areas enough. Getting a massage can be good, although that can be a little expensive. Listening to calming music. Hobbies are great. I mean, sometimes you can do those things where you can be involved in something for hours and time just flies by and you don't know where it went. Or manicures or pedicures. You have people who do nail biting and nail picking. Sometimes that can sort of help in that way. Then there's habit blockers, things you can't do and do your habit at the same time. Beyond fist clenching. First of all, we have people throw out all pulling and picking implements. I usually have people get rid of their tweezers and other type things. Tweezers are the #1 item. Usually I have people either put them in the trunk of their car, or another creative thing I came up with was to freeze them in a block of ice. You get like a half-gallon milk container and you fill it half full of water, you freeze that, you drop your tweezers in and fill it the rest of the way up and then freeze that. So it's like right in the center of this huge block of ice. So if you're going to get it, you're going to have to really want to go after it. It works. Cutting your fingernails, that way you get a splinter and you don't need tweezers, you can still get it, but it's going to take a little work. It helps the more impulsive people. Cutting your fingernails very short is very good, believe it or not. Applying acrylic nail tips. That's worked great, by the way, for some people. It has the opposite effect. Some people use the acrylic nails as tweezers and pull out hair. They really do. It sometimes works against you. So you have to be careful who you recommend that to. I know all the tricks by now. I've been doing this a long time. Switch grooming activities. Sometimes when you're less tired and stressed. Sometimes I find a lot of my women patients do some of these grooming activities in the morning before they have to, when they're in a rush to get out of the house or to go to work or sometime, to do these things, because it always leads to trouble. So I tell them, do it in the evening, do it at a time of day when you're more relaxed and you're not in a hurry, so there's not as much temptation there. I tell people to trim eyebrows with a scissor to get rid of those longer, funny feeling hairs, to try to cut down on the feeling things that, that it doesn't belong there kind of feeling. Let a professional perform grooming activities. I've had, people let professionals, do pluck their eyebrows. You can get people to do that, or manicures, or any kind of grooming activities like that. Wear eyeglasses. That's not a great one, but I threw that in. I know a couple of people that work for it. And getting electrolysis or laser treatments to remove stray hairs. I had a case last year of a fellow who had pulled out all his eyebrows, and he started pulling out like stray eyebrows that were sort of growing outside his eyebrows a little bit, and he just couldn't control it, so I sent him to a dermatologist who did laser hair removal, and they completely removed every single hair growing outside his eyebrows, and lo and behold, the problem stopped. He could look at himself in the mirror, he didn't see anything that bothered him, he didn't feel anything that was out of the way, so he just seemed to lose interest in it, and that was it. So that was very interesting. More habit blockers, there's all kinds. Avoid or cover mirrors. A great thing for covering mirrors, by the way, is plastic wrap. Couple layers of plastic, because you can peel it right off and then put it right back. And I've had college students living in dormitories, bring some, they share bathrooms with other students, but you can't just cover the mirrors, tell them to bring plastic, bring a little piece of plastic wrap with you and put it over the mirror when you're in the bathroom there by yourself. Get rid of magnifying mirrors, those are terrible, they're the worst. Darker tinted lenses when you're in the bathroom. I actually have people wear dark glasses when they go into the bathroom. From mirrors. Refrain from wearing eyeglasses or contacts when performing grooming activities. I think Christina said that she had a harder time pulling and stuff like that as her eyes got less good. So wear a hat in the bathroom or around high-risk areas. Hats are still good. You're in the house, you can use them. I have a couple of patients who they help a lot. For the women, I say use a compact mirror when you're putting on makeup instead of the big mirrors. You got that in one hand, you got your makeup in the other, and there's nothing left over. So have your hair dyed. This has worked excellently for several of my patients. This is for people who pull gray hairs or hairs of a different color. Once you eliminate that, that seems to completely eradicate the problem. And it's amazing that more people come in and they haven't thought of it, and I tell them, they say, oh wow, why didn't I think of that? But I say, well, yeah, I don't know, but it's a common sense idea basically, dyeing your hair when you pull gray hairs. It worked terrifically for a woman I saw toward the end of last year, and she finished up in a fairly brief period of time. That quelled the problem, because it was all visual with her. It was all the sight of gray hairs. So when she looked to see them anymore, that was it. So, I don't mean to make it sound like it's a miracle, oversimplified truth, but for some people, it almost is as simple as that. If you get that right trigger, you get that thing. That's not the case for everybody, because most people it's more complex than that. But occasionally, if some of you fall into that category, it just might help you, or it might at least reduce what you're up against to a great degree. Wearing white cotton dermatological gloves. These are very handy things. But I brought along a little pair to show you. I always show them to my patients. These are stuff you get, in the drugstore that people use when they put medication on their hands and things like that. These are very, very handy things, and they breathe. They don't make your hands sweat. You can wear them to bed. For people who pull when they're falling asleep or waking up, these are very handy. They're very good. Or if people bite their nails and stuff when you're just sitting watching TV and things, you put these on, and obviously you could take them off and still do your behavior, but you have to be, again, you can't, it gets rid of that impulsive, automatic quality. You have to take it off and really be thinking about what you're doing. To say, hey, now I'm going to take this off and I'm going to do my behavior. So dermatological, and they're cheap too. They're only, a couple of dollars a pair, and when they get dirty or worn out, you can just throw them out and get another pair. Habit blockers, part 3, it's like Jaws 3 or something. Driving gloves in the car are really excellent. Quite a number of people pull while driving or bike or kick. Getting a textured steering wheel cover, I have a few people who like that. Those rubber covers with little bumps and grooves that you can snap over your steering wheel. That works for some people. Some people wearing a hairnet to bed is good. Don't linger in bed after awakening. Some people just lying there, it leads to all kinds of pulling and kicking, so I have to jump right out of bed and get out of there. And also don't go to bed until you're ready to sleep. Some people lie there awake and do all these things. They say, wait till you really know you're going to fall asleep as soon as you put your head down and then go to bed. Hat or bandanas, I think I already mentioned in another section here. Band-aids or tape is a very obvious one. A lot of people do this. Sometimes it works, sometimes it doesn't. But it can if it's done properly. Avoid wearing shorts or short sleeves shirt. That's more for skin pickers, really. Or use hairspray, mousse, or gel to change hair texture. Sometimes that's a good thing. Sometimes it can make you want to pull more. It depends. If you're one of the people that it works that way for, great. Use it.
Question?
Yeah.
The idea of wearing shorts or short sleeve shirts, could that backfire in that if a person skin picks, then they could cover up the wounds with the long pants or long sleeve shirts?
Yeah, but also they're going to keep working at those wounds if they leave them open and accessible. So they're better off covering them, quite frankly. People can cover anything they want, but I still think that if you block access to it, it's got to be better than just leaving it wide open. Yeah. Basically. Now, as far as last bunch of habit blockers. This is sort of an emergency thing. I tell people when all else fails, stick your head under the tap, basically. It really works for a lot of people. Or apply conditioner, it can change the texture of your hair some way. Again, none of these things are perfect, but you may find these all come out of my book, by the way. I got all these things in my book. But these things can help braiding your hair, can sometimes help just getting it out of sight and pulling it back. Can be help pulling your hair into a ponytail. I have a patient right now that just worked great, where she was not only pulling her own hair, she was pulling hair out of a wig that she wore. So she just got a new wig that has straight hair that was longer, so she could pull the wig back, because she was not only pulling her own hair when she could see it hanging down like here, but she also did the same with her wig when the hair was hanging there. So now she pulls it back tighter and she can't see it, and that seems to have really eliminated a lot of her pulling. So that was her particular trigger. You got to find what your triggers are. I go over all this in hopes that some of this will resonate with you, and you'll just say, oh yeah, that's something I could use, or that's something that sounds like me. Applying mascara extra heavily when at home, just for eyelash. Sometimes it makes them feel different, and the person doesn't want to pull because they don't like the way it feels. Wearing false eyelashes, that's so-so, I don't know. Avoid body positions that lead to pulling. It's like I was telling that person, talking about sitting in a particular posture with your head in your hand. That's an example of something you would try to avoid doing. Playing an active video game that requires both hands. Taking a nap when you're tired. Something as simple as that sometimes can make a difference. Some people pull when they're tired. I say, well, fine. Take a nap. Don't be tired anymore. Do something about it if you can. Play a musical instrument. Again, that works for some people. And keeping your hair and scalp clean. Interestingly enough, some people, they don't wash frequently enough. They get like itchy scalps, and that leads to pulling. And as soon as you get your hands up there, you're in trouble. So, let's see. Got some special tips for skin picking and nail biting. One is to keep nails trimmed and smooth. And this is probably the most single important thing you can do for nail biting, because people always look at those little rough spots, those little bits hanging off. So if you always carry an emery board with you, or a nail file, and a little trimmer, and you keep them nice and smooth and free of all those little bits hanging off, you can usually eliminate a fair amount of nail biting. Wear gloves in all trigger situations. I already showed you the gloves. Use cortisone ointment to help heal skin sores. This is for skin picker, very important. Treat all skin sores or insect bites immediately. Again, you don't want to create something that you're going to want to start working on, and that'll get you going. Moisturize dry skin and cuticles nightly on a regular basis. This is very important for cuticle biters and nail biters. I usually have them either wrap Band-Aids around their fingers. In fact, as I say, use Band-Aids and petroleum jelly or antibiotic ointment. That, which is very good also. If you have a heavier duty problem than moisturizer will do, then actually put Vaseline on it, wrap it in a Band-Aid, and leave it overnight. It really will soften the skin tremendously, especially if you have these dry bits of cuticle hanging off. It will really help, and it'll also help it heal faster too. Again, as you see, when all these things, we're coming at these things from all different directions, as I said. Should make a little slide about that actually. Changes to environments or routines. Again, this is pure stimulus control stuff. Breaking up daily routines to disrupt change of behavior. Minimize time spent in high-risk rooms. Like if I have one girl, she has to stay out of her bedroom as much as possible, because whenever she's in there, that's where it happens. That's the one locus of all her pulling and picking is in this one room. So she goes in there, does what she has to do, and gets right out again. Stand further back from mirrors. Rearrange the furniture, cover mirrors, dim lights. All these things are very important. You can change where you sit when you watch TV, or put a dimmer in your bathroom. Instead of lights on, lights off. Spend less time alone. Some people find they do better when they're around other people, less likely to do their behavior. Do reading and writing work in public locations. Sometimes I'll tell my students who do this, I'll say, go to the college library or something and sit near the front desk, or where there's other people around in a lounge area, so that you're not sitting off. Sometimes when they sit off in a cubicle by themselves where it's too quiet and they're alone, that's when they'll do it. Avoid chairs and sofas associated with pulling or picking. This is very important. Avoid combining high-risk activities. This is a very common sense thing. I tell a person, if you pull when you read and you pull when you lie in bed, what do you think is going to happen when you read lying in bed? But sometimes you got to tell people. So again, we watch out for combining. I call them high-risk activities, activities that are most likely to lead to these things. Use a cordless phone and talk in lower-risk areas. Some people, have special spots they like to sit when they talk on the phone that lead to these behaviors that have become associated with that through repetition. We're trying to disconnect these behaviors from all these other things. So if you create enough of a space between yourself, sort of weaken the connection, you weaken the likelihood that you're going to do these things when you're in these situations. And when all else fails, they leave the house. If you do it in the house. Somebody asked me what reminders and attention getters was all about. There's another way into this problem. Is they put notes and signs in key locations. I actually have people put up signs that say high-risk area, and they put it right wherever that area is, right where they can see it. Because I want them to know that they're entering a spot where they better be on their toes and they better pay attention. As I said, post high-risk areas, signs, right? Post lists of. I have people put up posters that actually list the times, places, and activities to be aware of. So I try to keep this foremost in their minds, so they always know where they're supposed to be and what they're supposed to be doing. Makeup and display and aggravation. There's a list I think will make up of all the things that your problem costs you, all the problems it creates for you. Sometimes people need to review that as a reminder, something to get their attention, Saving quote. This is one thing I don't like to do very much. I know some therapists do this a lot. I only do this as a last resort, and with the person's agreement, basically. It can be kind of humiliating to make people do that, so I don't like to do it. But if somebody will want to do it, some people have actually asked me if they could do it, but I don't ask them to do it much myself. Post photographs of yourself taken before you began pulling or picking. Again, sometimes that shows the person what they're trying to get back to. It's a reminder. Write a note to yourself on the back of your hand. Great place to write notes to yourself. It's always there. You're going to see it. It's right in front of your face. So anyway, these are all part of this whole area of things we call stimulus control. And this is obviously aren't even totally inclusive lists. I just put some of the most popular things in here, things that I've done and I've seen people do that work. Okay, yeah, belief enhancements. Somebody asked me about this also. Self-statements to motivate yourself, like the good saying that some people use is every hair counts, for instance. Because some people say, oh, I'll just plot this one hair, what difference does it make? So we tell yourself every hair counts. Or any other little saying that has meaning to you that will get you on track. Call a supportive friend or a member of your support group. If you're in one and you're struggling, reach out to other people. They can be encouraging. Although don't depend upon other people, but they can be helpful. Read a book you find inspirational. Some people get inspiration for recovery through these things. Of course, cognitive therapy helps people also enhance their belief in their ability to get well and that they're not defective or weak or incapable. Post a list of inspirational sayings, affirmations, or phrases, anything that gets you going. That really says, yeah, I can do this, or yeah, I got this. This reminds me of what I'm trying to get done here. A list. This is the opposite of an ancient list. It's a list of all the advantages you'll have if you stop pulling. And finally, hang up pictures of people you find inspiring. Maybe there's somebody who really inspires you, who's accomplished something, who you admire and you would emulate. So, again, these are all just possibilities. Okay, so getting back to weekly review and self-evaluation. Again, this is something we do on a regular basis, and I think you always have to constantly evaluate how you're doing and what you're up to. When should a person use medication for BFRB? I know there's other talks here on medication, and I don't, I'm not an MD, and I don't, but there's certain criteria that I use when I refer people for medication and when I feel it becomes necessary. But some people say, oh, should I just start that at the beginning, or do I really need it? Or there's a lot of questions people have about it. One is, some usually say, when the urges are almost irresistible, and often when experiencing them, you do not care about anything else except satisfying them. I have some people who say to me, I really want to stop, but you know what? When I get the urge, all bets are off. I don't care. I'm doing everything you say, but when I feel like doing it, I just do it, and I don't care. So we say, okay, then, like we said at the the autistic site, where it says it's the wiring, stupid. Well, you got to deal with the wiring. Sometimes you can't. Sometimes that biological part of this is so compelling that you can't ignore it, and you do so at your own risk. I don't believe everybody needs medication, but I don't believe that you should just categorically be against it either. I think medication is safe if it's administered properly and you have a good physician. It's only as good as the person administering it. But if you have a good physician, you have somebody who knows what they're doing, it's safe. I've seen many people use it, and it has been helpful. But it has to be used judiciously and has to be used carefully. Sometimes it says that everyday life and relationships are seriously limited. In other words, a person, or actually sort of combine these two, where a person's become unable to function in certain ways, where they become housebound, or they can't, they're having like serious relationship problems and other stuff, and we need some kind of an intervention that's going to, at least give us some breathing space here, kind of just bring down the biology of this thing. So I might recommend it in those cases. I say you've done extensive damage to yourself or your peers. If somebody's put their health at risk, or really risks damaging themselves, or like digging holes in their skin, or is having serious infection problems or stuff, I'm going to do this because that person's life and health and safety come first, and I don't mess with that. You have to take that into account. You're extremely depressed and lack energy for treatment. I always tell people never underestimate the power of depression. Okay, some people can be so depressed that they can't do any assignments or keep records or follow any kind of treatment because they can't even get out of bed in the morning. They haven't got the energy. Some people also come to me not only with a BFRB, but they're suffering from biological depression. Or even they can maybe be very depressed over the fact that they have the problem. So sometimes just to give them an edge on their problem, to get their energy levels back up, to get them feeling a little more optimistic, to lift their mood a little bit, I may recommend that they get treatment for that. Maybe as they're doing, if it's not biological, this depression, and they start improving, you can usually remove the medications later on. But there's some people, even if they're improving and getting better, they're still depressed. So then you know it's biological. And finally, that you're experiencing significant amounts of stress and or anxiety and are having serious difficulty coping. Some people come to me not only with these problems, but they have life problems that can be extremely profound. They have health problems or family problems or vocational problems. Sometimes the person just, again, needs something to just give them a little relief, just something like a break from some of these things, just take the level of things down to give them a fighting chance. So that's when I would recommend medication. Now, the most common medications, as we know, are SSRI type antidepressants. The one that everybody always asks me, what's the best one? And well, I'll get to that in a minute. But the one that we most commonly recommend, first and foremost at our clinic, is the drug Lexapro. Now, will that work for all of you? No, probably won't, but it'll work for some people. We like it because it's very potent, and it seems to work for the most people with the fewest side effects. But any of them could potentially work for somebody. Some of the typical antipsychotics. I don't recommend these anymore. These are the old ones like Mellaril, Thorazine. We don't use Haldol. We don't use them anymore, but I put them because these you will hear about them. And I usually put it so that if your physician recommends it, you can say no, thank you. They have really nasty side effects. Some of them are permanent. I don't want to take it. But the atypical ones, the newer ones like Risperdal, Seroquel, things like that can be helpful. Abilify. Again, they're not wonder drugs. They're not magic bullets. They will, in some people, reduce the urge to pull, and in a few people, they will reduce the urge to pull to a great degree. And in some people, they won't work at all. So again, these are not magic bullets. Carol Novak has used lithium. I don't know too many other people. She says that it's worked for some of her patients over the years, lithium alone. This is a very interesting drug, Revia, or naltrexone. It's a narcotic blocker. Actually, some people think that it blocks, these opiate receptors, which it does in addicts. They take the drugs that they normally take, they don't get high. But some people, Gary Christensen, who was one of the early researchers and has had a lot of unpublished data on Revia, and he found about 50% of the people in this treatment group, he never wrote up the study, but about 50% of the people actually showed improvement on this drug. It's a narcotics blocker, as I've said. It's very interesting stuff. And then alternative treatments. Now, under alternative treatments, I get emails from all over the world. People say, oh, this works, and that works, and the other thing works. And you know what? I can't argue with them. If somebody says something works, it probably does for them. But will it work for everybody? I don't know. But the one alternative treatment I have seen work for quite a number of people is the B-vitamin Inositol, which is and I have articles on this on my website if you want to read about it. Track record in double-blind studies for obsessive-compulsive disorder. And we started using it for BFRBs about 10 years ago now. And it doesn't work for everybody, but I've actually had 2 cases in the last 2 months where pulling completely remitted on inositol. And I'm not making this up. One was a school teacher in her mid-30s, good years, and who literally lost the urge to pull. After about 4 weeks on inositol, she takes the full dose. She takes about 18 grams, which is sounds like a lot, but it's not toxic, and you can take large amounts of it. In fact, my own son has been on it. He's been on it for 10 years, and it stopped a severe nail biting problem. He once had no fingernails and toenails, but now does. So it's interesting stuff. Yeah.
Is that a prescription?
No, you can get this at any health food store. You can buy it online. Yeah.
Do any people improve on placebo?
Yes, some people probably do, and placebo effects do cause noticeable changes in the brain, and there have been some recent studies that have shown that. But my own son is a pretty good example of somebody. My son's autistic. He doesn't even know he's taking inositol, so there's no placebo effect with him because we mix it in fruit juice that he takes with some vitamins twice a day, so he doesn't even know. He doesn't know what inositol is, and he doesn't even know he's taking it, and it works. So that, and there are double-blind studies, say with OCD, where people were on placebos, where the inositol worked better than the placebo. So it's very interesting stuff. I recommend to most of my patients to try this stuff. I tell them, I say there's no risk, it might help, and you got nothing to lose, so why don't you give it a try. The school teachers, I was saying, she stopped pulling after 20 years. At the end of the first week, she came in 1 week and suddenly reported that she hadn't pulled at all that week. And I said, well, when was the last time? I said that you went a week without pulling. She said, I've never gone a week without pulling. So then I knew something was working for her. And the other patient was a 10-year-old girl who sort of ADD-ish, and also after several weeks just stopped pulling. She was keeping pretty good records, and she just says, she says, I don't think about it anymore. She says, I don't want to pull my hair. I don't really care about it anymore. She really stopped. I usually give them a dose of about half the adult rate is what we recommend. It's not toxic, as I say, so you know it can't do them any harm. But instead of 18 grams is the maximum adult dose for kids who are about half adult weight, we usually recommend about 50% of the adult dose. So 9 grams would be the maximum for a kid. Yeah.
Didn't you say in your book that caffeine counteracts the benefits of this?
Caffeine can lower inositol levels. Yeah, and also caffeine is a stimulant, and if you have problems with regulating your levels of stimulation, you probably don't want to be taking caffeine anyway. So I usually recommend that my patients give up caffeine because there's no nutritional need for it. I myself gave up caffeine about 10 years ago. It was giving me heart palpitations, so I was getting kind of overstimulated on it myself, and I just drink decaf, and it works great for me. Yeah.
So inositol, is that like a vitamin?
It's one of the B vitamins, yeah.
Is that what the label's going to say? Is that, yeah.
The label will say inositol, yeah.
Oh,
It's also been referred to as vitamin B8, but you'll never see it called that anywhere. Yeah.
Is it safe to take it in addition to another?
Yes, it will not interact with prescription drugs. There was some talk a few years ago about interacting with lithium, but when some people at a place called the Lithium Information Center found out that I was saying these, at least expressing some doubts about it, they were like all over it. They sent me all these materials which seemed to indicate that it didn't interact with lithium. So it's probably okay, but I would still be kind of wary if you were taking lithium. I might still not want to take it. Yeah.
What about Luvox?
No interaction with that. I have people who take this as an augmenting agent together with prescription antidepressants. Never seen a problem with it. The only side effects, some people get gas or diarrhea, but it goes away within a day or two. If you're one of these people that just doesn't agree with it and the gas and diarrhea don't go away, then okay, you can't take it. But most people's GI systems seem to adapt to it after a few days, so it's not a big problem. My son, for instance, has never had a side effect. Yeah.
So in your patients and your son, will they basically cure you when they quit taking the inositol?
No, you have to keep taking it because that seems to, it acts like a control, but it's not a cure, basically. Mostly I recommend people taking powdered form, by the way. Rather than in capsules, because you take large amounts, you have to take a fearful number of capsules. On 18 grams a day, usually you have to take about 36 capsules a day. If you take with powder, you can mix with juice or water. Iced tea seems to work pretty well. Yeah.
Have you ever tried reducing the dosage to see if it'll work?